Hand Hygiene and Vital Signs by Grace. Hand hygiene is a vital technique to be mastered by all healthcare professionals as it assists in breaking down the chain of infection. Hand hygiene should be conducted before contact with a patient, before an aseptic task, after exposure to bodily fluids, after direct contact with a patient, and after contact with patient surroundings. Before starting the hand washing process, it is important to ensure that any cuts or abrasions are well covered, nails are short, and any jewelry is removed. Hands should be washed with an antimicrobial soap when they are visibly soiled, however, an ethanol-based hand rub is appropriate at any other time. This will help to reduce the count of microorganisms such as E. coli. By following these few simple steps, you'll help to ensure that your hands are free of potential contaminants. Before taking a patient's temperature, it is important to ensure that they are in a comfortable position, preferably sitting or lying down. Prepare the thermometer by placing the plastic cover onto the probe. First, you need to determine the appropriate temperature site for the patient, with the most common places being either the ear or the mouth. Next, it is important to explain the procedure to the patient. Place the thermometer into the auditory canal of the patient's ear, then obtain the temperature reading and record the results. When taking a patient's pulse, firstly choose which pulse site on the patient you will be taking and explain to them the procedure. To take a radial pulse, place the tips of your first two fingers over the groove along the radial or inner wrist. Compress against the radius and determine the strength of the pulse. After the pulse is felt, look at the watch's second hand and begin to count. In obtaining a regular pulse rate, count the beats for 30 seconds and then multiply by 2 to achieve the number of beats per minute. After obtaining the patient's pulse rate, move the patient's arm onto their chest and begin counting the number of respirations made in 1 minute and record the results. When taking a patient's blood pressure or BP, it is important to ensure that they are in a comfortable position with their arm relaxed. First, you need to choose the appropriate size blood pressure cuff for the patient's arm and place it according to the directions with the center of the bladder over the brachial artery. Determine a baseline BP by feeling for the obliteration of the radial pulse when the cuff is inflated. Slowly deflate the cuff. Now place the stethoscope in your ears and the diaphragm on the patient's brachial artery. Inflate the cuff once again to 30 millimeters of mercury above the palpated systolic pressure. Slowly release the pressure valve and allow the gauge to fall at a rate of 2 to 3 millimeters of mercury. Note the point on the gauge when the first distinct sound is heard, phase 1 of Korotkov sounds, and record as a systolic reading. Continue to deflate the cuff until the final sound is heard, phase 5 of Korotkov sounds, and record the diastolic reading. Now remove the cuff from the patient's arm.